Eczema is one of the most common things I treat, and I love treating it because it responds so well to naturopathic medicine. A little background on it first. It can appear at any age, but often appears during the first year of a child's life. It actually affects 10% of kids. That's a lot. There are subsets of eczema, including atopic dermatitis, contact dermatitis, and dyshydrotic eczema, to name a few. Any part of the body can be affected, but especially the elbow crease and behind the knees, as well as areas around the scalp, the ears, and on the hands and fingers. The skin is often dry, red, itchy, sometimes oozing, crusting, and scaling, with decreased water holding capacity, which really makes it very dry and cracked. Causes of eczema. So the multifactorial, as with all chronic issues. Usually there is a family history of eczema, which suggests a genetic predisposition. Actually, a family history is typically present in about 70% of patients diagnosed with eczema, amazingly. So it can flare up and calm down depending on internal factors such as emotional stress, bacterial skin infections, sweat, hormone fluctuations, and external factors sometimes can affect it as well. Heat and humidity, pets, dust, other allergens, cosmetics. Wool is actually a big exacerbant in some people. When I'm looking at eczema, I'm digging a little deeper to look at three root causes. Number one, food sensitivities. There's a very strong connection between eczema and foods. So common foods that aggravate will be eggs, cow's milk, food additives, tomatoes, chocolate, wheat. These foods actually damage the intestinal lining, which can in turn lead to more reactivity. We always test for food sensitivities. And this leads to number two. So we just mentioned the intestinal lining. This kind of plays into the category of gut-skin axis. There's always going to be changes in the microbiome in people with eczema. Studies show increased species of inflammatory bacteria in the guts of people with eczema and increased gut epithelial inflammation and LPS, which is an endotoxin, which actually damages the skin structure. So we see a lot of LPS in our eczema patients. So we test for that. We test for intestinal lining dysfunction as well. So number three is anti-inflammatory impairment. People with eczema actually lack an enzyme called delta-6 desaturase, which allows for the proliferation of the pro-inflammatory prostaglandins, which are kind of to blame for eczema symptoms often. We often will use primrose oil, evening primrose oil, to bypass this. We also evaluate people for their fatty acid levels, omega-3, 6, 9. So when there's an imbalance in these, it's very common to see people prone to skin inflammation. Again, very common in people with eczema. And so when we know where those deficiencies lie, we can properly treat and supplement, with things like fish oil, algae oil, and dietary changes. So we have so many tools in the naturopathic toolkit for eczema. These are just a few. If you have questions or struggle with eczema, please know that there are root cause solutions.